Nissen Fundoplication is a surgery to treat gastroesophageal reflux. During the surgery, surgeon creates a new sphincter at the bottom of the esophagus to prevent reflux of the acid to the esophagus. Patients whose heartburn is not well controlled by medication, and also the patients who have side effects of the medication, are the candidates for Nissen Fundoplication surgery. Possible complications after Nissen Fundoplication include bleeding at the surgical site, and the rate is around 1%, difficult swallowing, which called dysphagia, the rate is around 1 to 5%, and difficult belching in the long-term period. Nissen Fundoplication is a laparoscopic surgery. In other names, it's a keyhole surgery. In this surgery, we perform small 3 to 4 incisions and insert a camera inside, focus on the esophagus and the stomach. During the surgery, surgeon wraps the top of the stomach around the lower esophagus. This reinforces the lower esophageal sphincter, which is likely to prevent acid reflux to the esophagus. The duration of the surgery is around 1 to 1.5 hours. Nissen Fundoplication procedure is performed under general anesthesia. Before the surgery, we are performing endoscopy. Endoscopy shows us possible results of the reflux, which are esophagitis, ulcers, and gastritis. And also, pH monitoring test is important before the surgery. This shows the pH level on the esophagus. In other names, it is the acid level coming to the esophagus from the stomach. pH monitoring test involves placing a catheter into the esophagus. We keep this catheter around 24 hours, and the results shows us the pH level. The results show us the acid level in the esophagus, and this shows an objective diagnosis of the gastroesophageal reflux disease. Around 4 to 5 days will be enough for the patients coming from abroad. The day before the surgery, we will perform all the tests, and also if needed, the pH monitoring test will be done at the day before the surgery, and the next day patient will be ready for the surgery. The following day, patient can be discharged from the hospital. 1 or 2 days more staying here will be better for our patients for the last check. A patient who needs Nissen Fundoplication should be performed endoscopy and also pH monitoring tests. If these tests are performed in their countries, it will hasten the treatment period. So we want to see the endoscopy reports and histopathological reports, and also if there is pH monitoring tests. In the first week after Nissen Fundoplication, patients should be fed with soft liquid foods. And also during the first month, it's not recommended to eat the ingredients that increase reflux symptoms. After Nissen Fundoplication, patients can do light activities in the first week. They should avoid from heavy activities in the first month. There is usually minimal pain after this surgery. Patients will feel sore on the incision sites, and also the shoulder pain in the first 2 days may occur after this surgery. According to the laparoscopic side of the Nissen Fundoplication, patient can go back to their work in 2-3 weeks normally. Many studies report good results after Nissen Fundoplication, and the symptomatic success rate is around 80 to 95% in the long-term period. Most studies show that around 90% of the patients give up their medication for reflux in 5-year follow-up. For gastroesophageal reflux disease, there are some alternative endoscopic treatments. Stretta is the most known procedure that can be performed with endoscopy. It's a kind of ablation of the gastroesophageal junction. Magnetic augmentations are other treatment option for this disease. Also nowadays, endoscopic fundoplication treatments are discussed in the literature. We can say that surgical treatment is nearly a gold standard. The endoscopic treatments are better than medical treatments, but worse than the surgical treatments according to the literature. Improvement of quality of life after Nissen fundoplication can be seen around 80% of the patients. This improvement can be observed early after the surgery. Complications of Nissen fundoplication are dysphagia, diarrhea, flatulence, and recurrent heartburns. The rate of these complications are around 5%. After Nissen fundoplication, most of the patients stop taking anti-acid medication. Some patients will continue anti-acid medications to treat the esophagitis which occurred before the surgery for around 3-4 months. The recurrence of the symptoms after Nissen fundoplication may occur with a rate of 2 to 5%. After Nissen fundoplication, there is no positive or negative effect on absorption. But if we speak about digestion, in some patients, gastroparesis, which can be defined as delayed emptying of the stomach, may occur after the surgery, and the treatment of the gastroparesis can be done with behavioral changes. The Nissen fundoplication is the most common procedure for treating gastroesophageal reflux disease. Gas, bloat, and inability to vomit can be occur severely after this surgery. The reason of these symptoms can be defined as a functional obstruction according to the wrapped stomach around the esophagus. Generally, in first 4 to 6 weeks, patients can see improvements in GERD symptoms. And dysphagia is an important symptom that should be followed after surgery.